I welcome you back to NST 305, Human Behavior in Health and Illness. This is study session 2, which is based on influence of culture and society on ill health. Health is a common subject in most culture. In fact, all communities have the concept of health as a part of their culture. Generally, health and illness are defined according to the values of the society to which an individual belongs. When a person is able to adjust and adapt to his environment, he or she is said to be healthy. The purpose of this study session is therefore to focus on the influence of culture and society on ill health, that is, the major role cultural issues play in patient compliance. When you have studied this session, you should be able to 1. Define the term culture, 2. Discuss the factors of culturally shaped illnesses, and lastly, identify the factors of illness. Cultural beliefs and attributes. Culture refers to the integrated pattern of human behavior that includes the language, thoughts, actions, customs, belief, or religious groups of people. It is important to know that people within any cultural group are not homogeneous, even though they may hold many beliefs and practices in common. They could differ in terms of educational level, English language proficiency, financial resources, sexual orientation, and so on. Every culture, however, has systems of health belief to explain what causes illness, how it can be treated or cured, and who should be involved in the process. People from many immigrant cultures also bring their beliefs and the practices that accompany them into the healthcare system. These advocate for many medical treatments that combat microorganisms or the use of sophisticated technology to diagnose and treat diseases. Some other societies believe illness is a result of supernatural phenomena and promote prayer or other spiritual interventions that counter the presumed disfavor of powerful forces. This often proves challenging to healthcare professionals who have been trained in the philosophy, concepts, and practice of Western medicine. Factors of culturally shaped illnesses. These often represent ways in which deep cultural messages are transmitted through the medium of the human body. The first of the factors is health behavior factor. The health of girls and women is particularly sensitive to cultural influences. Societies where women are able to make decisions for themselves, especially about their education and their reproductive choices, have longer life expectancy, lower fertility rates, and better overall health. But in societies where religious zealotry flourishes, women usually suffer oppression disproportionately compared to men, and this can adversely affect their health and longevity. Number 2 is the female genital mutilation. Another cultural practice that with severe health consequences is female genital mutilation. It is performed on young girls in many African and Middle Eastern nations, and in its most extreme form can be life-threatening. It deprives women of sexual fulfillment and makes childbirth a hazardous process for both mother and infant. And last of all is the illness behavior factor. The study of illness behavior is concerned with the way people monitor their bodies, define and interpret bodily indications, make decisions about needed treatment, and use formal and informal sources of care. Like other behavior, illness behavior is learned through socialization in families and peer groups, and through exposure to the mass media and education. There is great diversity of attitudes, beliefs, knowledge, and behavior, all of which affect the definition of problematic symptoms, the meanings and causal attributes that explains them, socially anticipated responses, and the definition of appropriate remedies and sources of care. Motivation and learning affect the initial recognition of symptoms, reaction to pain, and the readiness to seek release from work, school, or other obligations, and to seek help. Recognition of illness and illness appraisal. Illness behavior begins with the recognition of illness or sickness in the body prior to the use of any health service. While a complex array of variables might explain variations in interpretation of sickness, they can be summarized in 10 general categories, some of which includes the visibility of defiant signs and symptoms, the extent to which the person perceives the symptoms as serious, the presence of or need of conflict with the recognition of illness or the assumptions of the sick role, the possibility that competing interpretations can be assigned to the symptoms once they are recognized, and the availability of treatment resources, their physical proximity, and the psychological and monetary cost of taking actions, as amongst many others. Illness appraisal, on the other hand, is a two-step process. The initial process has to do with how the person monitors his or her body to assess the location, duration, intensity, and persistence of discomfort, while the second step, which may occur almost concurrently, involves he or she seeking explanations for perceived changes. If an obvious explanation is not available or is disconfirmed by further checking, individuals look to their environment for new clues and explanations. These interpretations, in light of knowledge and other beliefs, may then play a role in the formal initiation of care. Causes of illness and traditional therapies. There are probably less causes of illness as well as traditional therapies for each of them, depending on the culture, religion, spirituality, and kinship ties of an individual. Some of these include natural causes, improper eating habits, exposure to cold air or wind, unhealthy relationships with human or nature, accidents, among many others. Some older adults may delay seeking medical care, preferring self-treatment and giving God a chance to heal, or may even seek care from folk healers and resort to prayer to treat the illness. Nonetheless, if a person believes the healthcare provider may disapprove, they may not be forthcoming with information about the use of non-traditional remedies, and these may result in drug-food or drug-drug interactions with prescribed medications. With this, we've come to the end of the class. Thank you for listening. I'll see you in the next class.